Hello everyone, I want to welcome you back to this other session. This is lesson number 15. Remember, we have already covered 14 lessons, and our previous exercise was an examination, was a cut. That was cut 1. And before we start our lesson, I want to appreciate all of you who participated in the examination. Actually, most of the students who did the exams, out of 200 plus students, majority of the students were able to score 25 out of 30, and that's recommendable work. I want to encourage you that you keep up with the same spirit so that we are able to work together so that we can have this language in our hands. Now, our lesson of today is about health, and health is signed using double H, this one. Remember this H. So health, this health, this health, or sometimes people sign also health, like this health. So meaning you are strong, your body is out of disease. So health or health. Now remember, health is a state of physical, social, and mental well-being of a person, in that your body do not have diseases or any infirmity. So that one we say your health is good. Now we are going to have the collections of different signs of vocabularies that are involved in health. Remember, some of our students are medics, and I want to encourage you that whenever you engage with the deaf patients, the patients who are deaf, make sure you exercise these vocabularies we are going to share, so that in the long run, not only are you going to be able to communicate so that you address the sickness, but also as a way of inclusion in the society. Now, amongst them, number 1, we have sick. You are sick. So the facial expression when you are sick, you have to accompany it with the appropriateness. Now, sickness or being sick is signed like this. So sick, I'm sick. This is sickness or sick. This one. Number 2, we have pain. This pain. You are feeling out of pain. Or this one, pain. So this one goes with, you point. If you are having maybe a headache, you point at the head, and then you do this. That means your headache is having some pain. So, but this is the recommendable sign for pain. That's pain. The next one is weak. I feel so weak. So weak, like this, weak. You are so weak, Or sometimes people sign like this. You are so weak, like this. The next one is strong. You look very strong. I'm strong. You look very strong. Healthy, strong. This is a sign for strong. The next vocabulary here is to breathe. So that is breathe or breathing. The next one is cough. The hearing, or in the normal situation, we cough like this. So in sign language, we do the same, but you don't produce the voice. So in sign language, that's coughing in sign language. And the next one is abortion, to abort, to destroy the expected child. You are expecting and you don't want to have that child, so you destroy, you abort. So to abort, a sign like this from the abdomen, like this, then like this. That's to abort or abortion. The next one is to improve. you are improving, you are gaining from maybe you are sick and you are gaining some health, you are improving. So we improve like this. So this is from here, improving. So opposite of improving is deteriorating, to deteriorate. So it starts from here like this. So this one is improving and this one is deteriorate, to deteriorate. The next one is fat. You want to say, hey, that guy is so fat. So fat like this. Fat, this one, fat. Opposite of fat is slim or thin or slender. So this one, like this. You are so slim, like this. Sometimes you also use E, like this, but now going down. You are so slim, slim. You are so slim. That's the sign for slim, slender or thin. And the next one is disabled or disability. This one is disabled or disability. The next one is blind, blindness, visually impaired, blind. So blind like this. So this is blind, 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 or two times blind like this. So n of them, n of the two, blind or blind. So that one means blind or blindness. The next one is the deaf, the one now we are very much concerned with, the deaf. So the deaf like this, deaf, meaning he cannot be able to hear. So deaf, sometimes people don't use this one, they use this one. So this one also means deaf or deafness. The next one is pregnant. You want to say someone is expecting, a pregnant mother. So signed from here like this, like this. Sometimes people use this one, but I want to discourage you because this one can also mean someone is fat and is having, you know, when you are fat and your abdomen is swelling in front. So this one can mean that one. But for an expecting mother, I want to encourage you that we use this one. So this one is pregnant or expectant. Someone's expecting. The next one is pills or drugs or medicine, the pills. So like this, like this. So those are the pills, medicine or drugs. We have cold. You are feeling so cold, or coldness. This one. The next one is cancer. Cancer is one of the diseases that is very dangerous. So cancer, sign like this, cancer, cancer. So depending on which cancer you are talking about, for example, skin cancer, you will touch the skin, then you say cancer. So that one, skin cancer. So this is the sign for cancer. But you can be so specific with which type of cancer you are talking about. So you first of all refer to that cancer you are talking about, then you put the word cancer. This is a sign for cancer. Cancer, like that. Cancer. The next one is hospital. Hospital. You draw H around here. H. H. Use H. Draw across. That one. So this is hospital using H. The next one is a nurse. There are nurses in the hospitals. So you make this sign, this one, curved, then you put it here like this. So this is nurse, medical nurses, this one. The next one is a doctor. Doctor, we are going to use D for dog, this one. Then the place of articulation is where we did the word hospital. So here, doctor, doctor, this one's doctor, medical doctor. There are others, some other people like Dr. Matiangi. It's not a medics, but it's a doctor. So for him, you refer to him using this one, D R, D R, or just D R, D R, referring to people like Dr. Matiang'i. But for medics, we sign like this, using D, where we did the hospital. The next one is ambulance. Ambulance, from the way the siren moves, the siren as it produces the sound. So that's ambulance. Sometimes people do this a car or driving. Sometimes people do this, then just to make, for the purposes of making what they want to give out to be so clear. So this is ambulance. Woo, 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 woo. So that's ambulance. The next one is to vomit. Vomit, practically people do this. That's vomiting in a practical way. In sign language, the same. But now in sign language, you accompany this one. So this one means the food is coming out like this. So you do this. But you avoid making the sound. But the facial expression can show that someone is vomiting. Like that. That's vomiting in sign language. Diarrhea. Diarrhea. We are going to use double D. D for dog. This one. Then sideways. Like that. That's the diarrhea. The next one, we are almost finishing. The next one is injection, or to inject. Injection, we use I. I referring to the, now this is the needle. So inject or injection. This one is injection or inject. The next one is blood. 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 The sign for blood is signed here like this. Blood. Blood. Like this. Blood. 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 But when you are interpreting and you want to refer, you want to mean, for example, that you are bleeding from your eye or somewhere, whatever part of your body, you point where that part is and you make the blood. For example, I want to say around here is bleeding. So you say this one. So that one means blood. Or you can do this. You emphasize like that. So this, you mean blood is coming out from here. Or you can still sign blood, then say. But the sign language, the correct sign language is blood has to come from that part of the body. For example, if it's here, blood comes like this. That's blood coming out from here. So that's sign for blood. The next one, dead. You want to talk about a dead person or death in general. This one. This is to die. Death or dead. A dead person. This one. Alive. Alive. We use a. Then like this. This one means alive. Someone is alive. Coronavirus. Coronavirus. We do this, and the way it's spreading so fast. So this is corona. So this is corona. Coronavirus. This one. This one is corona. So the way it spreads so fast. So this is coronavirus. The next one is HIV AIDS. We make eggs. This one. Then from here. This AIDS. Look at my face. That's the sign for AIDS. So that's how we sign those vocabularies in health. Remember, sign language, as I said from these other previous lessons, we cannot learn this language in a single day. Neither can we learn all vocabularies in every department in a single lesson. So these are some of the very common vocabularies in health that you will meet on your way as you interpret or you communicate with the deaf people. But there are others that we know that we have not signed already. So those one will learn as we go on. We'll go on learning as we engage ourselves with signings. Otherwise, see you in the next lesson.